everyone. Welcome to Left Undone, Incomplete Investigations. I'm Catherine. If you're new here, please say hello in the chat. We are doing a special weeknight live. So you get the pleasure of my company and some of my friends, my OB nurse friends today. So before we get started, everybody, please remember to be nice in the chat. We're not going to have a political debate in the chat. My mods will time you out or quiet you down if that happens. And if you don't know what we're talking about, we're going to talk about a case from a young woman, 19-year-old Alexee Trevizo, who said she was never pregnant, didn't know she was pregnant, had a baby in the hospital bathroom, threw it in the trash, got found out because the housekeeper found the baby, and all hell broke loose, basically. So I have two of my favorite OB nurses here tonight, and I'm going to bring them on. One is Kayla and one is Carla. They both are L&D nurses and high-risk OB as well. So let me bring them, and you guys can all say hi. Here is Kayla. Hi, Kayla.
Hi.
And Carla. Hello.
Hello.
So I don't know if you guys want to they know me. I've been an OB nurse for 21 years, 14 years in labor and delivery, 7 years here, where I work with these guys at High Risk OB Case Management. So I'll let them say hi and tell you a little bit about how long they've been nurses and stuff, and then we'll talk about the case. Okay? Kayla, go for it.
I've been a nurse for 13 years and labor and delivery for 6.
Perfect. And Carla?
My turn. All right. So I have been a nurse for almost 7 years. All of my experience has been in labor and delivery since I graduated.
And you're with us too at High Risk OB.
And now I do High Risk OB.
Yes. So we got a lot of opinions about this. Kayla and I don't completely agree. So it should be an interesting conversation. And we'll hear what Carla has to say as well. My DoorDash is 2 minutes away, so I'm not going to start playing until I go grab it from this person. So I'm going to step away for a second. But just so that you know, this case is like, these cases are really interesting to me for sure. And I'm sure to these guys, because this is what we do, right? And we can see things that other people don't necessarily see, like an ER trying to manage a OB case. Oh, Percy! All the dogs are going crazy, but someone's at my door. I'll be right back. Okay. You guys keep talk to the people. I'll be right back.
What do the people want to hear? It's my first time being a star.
Same. Well, I think for one, we are going to have all kind of differing views because I agree with some of the stuff that you have said, Kayla, and then other stuff not so much. So it'll be interesting to see what everybody feels about this case and how it's going to go down.
It can be a friendly debate. I respect differences of opinion.
Of course. It can always be friendly. What you doing? Oh, my dogs are like, ooh, what is mom doing? My husband's trying to quietly make it outside so nobody sees him.
What do we think Kathy ordered for dinner?
I don't know, but what is that? I'm going to go with a sandwich. That's what we have for dinner.
Correct. I ordered a sandwich.
Yeah.
It can wait. Because it can wait. Tell us all the gossip about Kathy. There is none, except for Kathy gets in trouble. But other than that, you know.
Oh, now I see the comments. Okay.
Can you see them on the right, or do you see them when I put them up?
I see this one on my left. On the very bottom of the screen. It's super tiny, so I might have
Yeah. Where Leighton said, tell us all the gossip about Kathy. So I will put the comments up as we go along. We are there. Well, Carla lives in Arizona and Kayla lives in Nevada and I'm in California. So since we work remote, we can work together far away.
Yeah. And I still work at a facility here in Phoenix on the weekends.
Same.
Don't ask me why, but I do.
Who's addicted to it? It is kind of addicting. It's hard to leave bedside, you know?
It really is, yeah.
Yeah. Especially, I don't know, there's something about labor and delivery that is hard to describe, but it's just crazy enough to where you get that cool adrenaline stuff, and then it's just happy enough to where you're like, this is great, you know? So
Yeah.
I agree. So I'm going to pop up so we can just show the timeline of when Alexee went to the bathroom and what happened. And I'll put it up on the screen and I'll pause it so we can talk about it. Okay. So let me see if I can share it. All right. So let me make sure it starts from the beginning. So 1:38 a.m. There she's going to the bathroom, holding her behind. You see that? She was holding her behind. And
Yep.
so for those of you guys that don't know what that means, she is having a lot of pressure, obviously, right?
Yeah, that baby was knocking on that door.
Yeah. Yeah, for sure. And so one thing that I thought was interesting when I think about the ER doing this, as a labor nurse, I'd be like, oh, no, wait a minute. You know, they knew she was pregnant, but they didn't tell her yet that she was pregnant, even though she most likely knew she was pregnant. They didn't tell her yet. So her mother, if she knew or didn't know, I don't know. Her mom throws me off, was concerned, but I think it would have been great if they would have told her she was pregnant prior to her saying, I have to poop and go to the bathroom.
Yeah.
You know? So I think that was one of the big mistakes. Let me continue this. So then the next thing that happens here is, where is it? I'm losing things. I got to put this up on the other screen so I can see both. 1 second. Okay. So that was at 1:38. She's going in the bathroom. And then at 1:30, this 1:39 now, the guy in the blue shirt there, that's the triage nurse. He was the one that triaged her, asked her what was going on. You know, she said back pain or abdominal pain or whatever she was telling them. And then her mom comes right now at 1:39 as well. She should be coming in here right now. Yeah, here comes her mom down to the door. And then triage nurse is still lurking. Another thing, I almost think that it probably would have been better if the triage nurse would have been a woman, because I think he hesitated a little more than a woman would have to go in that. Don't you think?
Yeah. Yeah. And I think female nurses, like, his first thought might not have been anything labor wise. And I think a female nurse might have maybe considered that as far as like, that's why she's taking so long in the bathroom.
Yeah, I think so too. So she, from the time she goes in until the time she comes out, is pretty long without anybody actually. That's the charge nurse going by there, 1:47 a.m. The charge nurse went by. So now it's 1:47. So she's in there and her mom again. So she's in there for literally 10 minutes at this point.
I'm surprised she wasn't making like more noise or crying. I mean, maybe she was, but obviously not enough to make somebody go, okay, I need you to open the door.
I know. Nothing. Like no. Yeah. Ugh. It's so weird. And they're there. Like, it's probably very quiet in that hallway, right?
Mm-hmm.
It's so, middle of the night.
If that baby would have came out and cried, somebody's right there. They would have had to hear it. It's an empty hallway. There's not patients in the hallway because they're that busy.
No, they said it was a pretty quiet night. At 1:51, the ER doctor's walking down there. That baby, so this is what I think happened with the baby. They did give her morphine, which is not unusual in labor and delivery. We do give morphine, but not necessarily right when somebody's going to deliver, usually earlier on in the labor.
Yeah.
So if they would have known how far along she was, they probably shouldn't have given her that. And it can cause respiratory depression in the baby. So the baby may not have cried.
Yep. That's probably most likely what happened. I didn't know they had given her morphine.
Mm-hmm. They gave her morphine. The baby in the toxicology report did have morphine in its system. So that, I think there was a whole lot of things that really went wrong in this whole scenario. At 1:56 a.m., the triage nurse again is there. And he, at this point, I believe he's saying he's going to get the key. Yeah. He told someone to go get the key because he's going to open it. So they're warning her, we're going to open the door. And okay, let me just answer this comment here. Nanner Chan, they knew that she was 9 months pregnant and didn't handle her properly. She should have put her in labor and delivery and not given her those drugs. Everybody except for the grandmother knew that. No, that's not true at all. They didn't know how pregnant she was. They don't have a labor and delivery in this hospital. They don't even have OB. That's why they had to ship her to another hospital. This hospital is not prepared for a labor and delivery patient at all. They're just not that kind of hospital. They don't have it. So don't go to that hospital if you're pregnant, because they aren't, you're going to get on a helicopter and go somewhere else. And nobody knew she was 9 months pregnant. She might have known she was 9 months pregnant, but I also have a little opinion about that too. I think she knew she was pregnant. I don't necessarily think she knew she was actually in labor. That's my thought on that. What do you think, you guys?
I don't know. Even though there's a show about it now about how people can go the whole 9 months and not know. So it obviously does happen. But seeing those pictures of her looking so pregnant, like, I find it really hard to believe that nobody or everybody's saying they didn't know, because those pictures, she looked very pregnant. And
yeah, the cheerleading pictures for sure.
Yeah.
I feel like if she knew she was in labor and this was her plan, she would stay home and have a dumpster baby. I don't think she would have asked her mom to take her there.
I don't necessarily think she did it on purpose. I think she panicked. I definitely think she was like, oh my gosh, what do I tell him? But there's just so much more, because then we have the conversation with her mom, which we haven't gotten to yet, about, after she comes out of the bathroom. So I don't know what was going in her head. That's where it's very difficult for me, because I'm like, in those pictures, to me, it just seems either she was raised under a rock and she was very naive, or she just had that fear and was like, I didn't know, or I didn't want to tell anybody. I'm going to let my dogs upstairs. Hey, let's go. Come on.
Yeah. I think she knew she was pregnant. I think Kayla and I were talking about this at work. I think she may be a little bit slow. Kayla says that too. I think she knew she was pregnant. I don't necessarily think she knew she was in actual labor. And I think she was hiding the pregnancy and hoping that, like, she decided to stop taking birth control. She asked the nurse this, and I'll bring that up. I have that clip. She asked the nurse that what would happen if you stopped taking one medicine and start taking another. And the nurse was like, well, I don't know what kind of medicine you're talking about. So, well, what if I stopped taking birth control and started taking weight loss medicine? What would you do? And she's like, well, I don't know. So why did she stop taking birth control and start taking weight loss medicine if she didn't know she was pregnant? And why was she taking weight loss medicine if she wasn't trying to either hide the pregnancy or do something to get rid of the pregnancy in some way?
Yeah. I know there's
TikTok told her to do it.
Probably. She was 19 and still in high school. She is not a mature 19-year-old whatsoever. She's very young, and her mom is very I don't know what to call her, controlling.
Yeah,
or just
her mom, I swear, is not. I don't want to blame her 100%, but if that girl knew, I feel like the mom is the one she was afraid of.
Like, I think you're right.
And like, was she
oh,
19 when she delivered, or is she 19 now?
She was 19 when she delivered, I believe. I don't know what her date of birth is. She says it in the one, they tell her, I think she said 2002 that she was born, because the cop comes to her door to arrest her, and they give her, she asks the date of birth, and I swear she said something 2002, which would make her 19 at that time. I don't know what month she was born. But I mean, you know, like, I sent my kids to school late because they have fall birthdays. So my kids got out of high school close to 19. You know, my daughter, she would have been 19 in September after she graduated in June. So some kids do go later. But, you know, a lot of people don't. We talk to people all day long who have contractions, have cramping, have this, have that. I don't know if I've ever had a contraction. I don't know what that was. Oh, really? I didn't know that was preterm labor. I just went in because I was having this back pain. I didn't know. They told me I was in preterm labor. People that have never had a baby don't necessarily know what labor feels like.
Yeah.
They can read books.
I worked with a nurse that went to her OB appointment in labor 8 centimeters, and they had to like ambulance her to labor and delivery. And she was a labor and delivery nurse. So
Wow.
it's not the same for everybody.
Yeah. Definitely.
Yeah. And it presents differently. Some, like somebody like her might think, oh, my water was going to break. My water never broke. So what the heck, you know?
You
like
hear that on too. My water didn't break, so I didn't think it was labor. It doesn't matter.
I know it surprises me how many people have to say it's actually pretty rare for your water to break before you go in labor. They're like, really? Yes. But on TV.
Yeah, exactly. That's what it is. On TV, they make it just seem like that's the start of it.
I think at that minute she thought she really needed the toilet, and she panicked and got a shock, and she scared her mom. It's scary. She scared her mom. Is scary. Yeah. I think she was afraid of her mom.
I think she panicked. I don't think she expected it to happen in the toilet.
Yeah, I definitely think she panicked.
She probably thought it was dead.
And if we're right, if the morphine is what caused the baby not to cry when it came out, yeah, she probably was like, what do I do now? This baby's dead. Not knowing that if she just, you know, called out for help, somebody could have maybe done something. I mean, and we don't know that they would have, you know, if they don't have any experience with babies at that specific hospital, maybe they wouldn't have, but somebody could have tried something.
I mean, ER nurses, they have to have like their pals and all their training in that, especially in rural hospitals where they don't have a labor and delivery. So if somebody comes in there and has a 27-week baby, they should be prepared to at least do immediate life-saving measures. So
you know what I think might have happened?
Things.
My thought is the baby had morphine. And yes, Lori had asked, does it really get to the baby that fast? It does. So the baby there's plenty of times when we've given it late and the baby comes out and the baby's like,
yeah.
And you're like, come on, baby. That's why we stimulate it and flick it and everything else.
Mm-hmm.
Come on, cry. But you also can give it Narcan. And I always kept it in my pocket if mom got narcotics. I had Narcan on hand. And Kayla says the hospital she worked at, NICU had to be there if mom had narcotic in labor.
Same at my facility now. If we give the baby any kind or the mom any kind of narcotics after, I want to say after 6 centimeters, or if they weren't 6 centimeters, then all of a sudden they're getting ready to blow out a baby because we relaxed them enough. You have to call.
Yeah, for us, it's within 3 hours. If they had it within 3 hours, NICU has to be there.
Yeah. So
if baby didn't cry, but how'd she cut the cord? The cord still blows my mind.
She probably chewed through it. I had somebody do that. That's my guess.
Yeah,
they're not easy to break.
No.
No, I know that one the doctor on Court TV said, "Oh, they're easy to tear." I'm like, no, they're not. You gotta go clip. It's like cutting a rubber hose.
Yeah,
they better not be easy to break. Like right. Really, that would not be very
safe. If you've ever had a baby, you see how long it takes to dry up and fall off their belly button. Like this reason it just doesn't come right off. Like it's thick and it's wet, so it's harder to even break. It's got the jelly stuff over it. That stuff takes a long time to get to a point where it can snap.
And I also feel like she, in my opinion, just because she took so long in that bathroom and the bathroom wasn't visibly like dirty, like right off the bat, I feel like she probably delivered barely after she got into that bathroom and had enough time to clean up most of the blood before the house.
They said there was a lot of blood still in there.
Oh, was there? Okay.
Yeah, they said there was a lot. There's an interview I'll show you. Like right now, the housekeeper. This is 2:25, so they had the housekeeper came. The time stamp here. The housekeeper came at. Hold on, I got it written down. Okay, at 1:57, she came out of the bathroom. At 1:58, you could see everybody looking in there like, oh, it's messy. And then at 2:08, housekeeping comes. 2:08, housekeeping comes. At 2:18, housekeeping's still cleaning. And then the last thing that the housekeeper said she did is she brought the trash out, because what Alexee did is she, you know how the bags are in the bottom. So she took bag out, wrapped the baby up, threw paper towels on it, and then took one of the new trash liners and put it on top so that it looks like a clean trash can. But it's only one of those small trash cans. You can see it. She has it out right here. This is 2:25.
Oh, hey, they said maybe somebody used the serrated edge on the paper towel dispenser. You did say it was frayed, right, Kathy?
Yeah, they said it was frayed. Possible. They also said, see the trash can? It's here, right here. It's just a small one. And the baby's in there. But she put a clean liner over it.
So sad.
So, yeah, and the housekeeper's calling for somebody to come right now. They must have their phones are on them or whatever, because she didn't go get her, but she comes right now. You can see. Here she comes. And this is when they all discovered that baby's in there at 2:26 a.m. They're looking. Now it's like, okay, let me get the charge nurse. This is not good. So they said, though, what I think happened, though, because they said the one wall between the sink and the toilet had blood splatter. Like it looked like somebody like hosed it. Like, I think that might have been the artery in the cord.
Yep.
Because she didn't clamp it, right?
Yeah.
She wouldn't have known that. Oh, and where's the placenta?
She's carrying.
That's what I want to know.
Yeah. What does she do with that?
See, they are now. They are.
It's not going to go down in one flush for a full-term baby.
So she chopped up the nurse. I mean, chopped up the placenta. Chopped up the nurse. Don't do that. Chopped up the placenta somehow. Was she in there? Like, I just can't even imagine what she was doing in there for her to get rid of everything. Because they weren't even sure that she had delivered the placenta. Yes, she should have pressed the emergency bell in the toilet. They said there's a cord in there. Her lawyer says she didn't know. She's never been in the hospital. Like, she's never had these problems. She didn't know she was had to be a cord. It was just regular public bathroom in the hallway. It wasn't a patient room bathroom. But they did hear a lot of flushing, a lot of trash. They take the baby in there, and then the doctor says, that baby is dead. Now this one's good. Let's play this. You can.
And this happened in January.
This is the triage nurse
of this year. Do you remember it at all?
Yeah, I'm assuming the 19-year-old that was pregnant.
Right.
Can you hear it? Okay.
Can you tell us what happened? What you did with it? What from the beginning, from like when you first saw her to when you left?
Sure. So I triaged the patient.
Okay.
Brought her to our triage room, asked her some of the intake questions, and then moved her to a treatment room. I probably started an IV, gave some medications.
Okay. Anything else?
Mm-hmm.
What was her chief complaint?
Chief complaint. I can't remember. I think it was abdominal pain or flank pain, something like one of those two.
Do you remember what treatment?
No female teenager with abdominal pain should ever be trusted.
Possibly two.
Right?
Okay.
And teenagers lie. So.
No, just kind of thinking of the layout of the ER.
Gotcha. So you triaged her from. So like, did you bring her in from the waiting room?
Yeah.
Okay, so you brought her in from the waiting room, took her in the treatment room, and then like you triaged her, you just got her chief complaint, did vitals.
Chief complaint, vitals. I believe the doc came in and kind of did a quick assessment in the triage room before we moved her back to a treatment room.
Which kind of blows my mind that the doctor hadn't picked up on it either.
Yeah, and And that's why I'm saying, like, even though Kayla said that ER nurses have to be prepped, if they don't see this a lot, it sucks to say this, but like L&D nurses, I better watch what I say right now, because if something happens this weekend when I work, knock on wood, but we don't use our CPR very often there. So it just makes me wonder how often they see, you know, being so rural, like stuff like this. So, I mean, did that baby even... I'm hoping that somebody's just like gut would be like, okay, let's just start doing whatever we can. But like, to me, that's like probably the most terrifying thing about being ACLS certified, is that we don't use it that often. So it doesn't matter how good the class is.
Right.
Come a year and a half later when my training is almost
NICU button.
Yeah, exactly.
Where's NICU? Hurry.
So yeah, why don't the doctor pick up on something?
And I am surprised that even with that baby in the bottom of the trash can, the housekeeper's like, there's a dead baby in there. And then they're like, get somebody. And then they go get somebody else. Like everybody. I would have pulled it out and been like, are you alive? Like, you know?
Yeah.
It was really weird. Like everybody there was in shock.
How long was it before somebody even touched it to see if there was a pulse or anything?
Well, so I had that on the timeline. So when the housekeeper brought the trash can out, hold on, let me go back. Housekeeper brought the trash can out at 2:25. At 2:26, the CNA comes and looks in it. At 2:26, the charge nurse comes. And then like another few seconds, then he runs back. He tells the doctor, because the doctor was doing a pelvic exam on her. Doctor's like, I was doing this pelvic exam on her, and I looked at her cervix, and her cervix was wide open and bleeding. And they said, you got to come quick. So then she came and she left, but she had already told the patient that she had a miscarriage. And then the patient and the mom were arguing, because she's like, no, mom, I've never had sex. I've never had sex. And they were going back and forth. Still, well, doctor's doing pelvic exam. That's what the one nurse's interview says. So she was still doing, so she's afraid of her mom, first of all.
That's what I think it is.
You know,
that would make sense why the mom made that comment. We've talked about this, because her mom was probably like, you better not be having sex. You better not be doing this. You better not, like.
She's Hispanic and they tend to be very Catholic. So,
yeah.
I mean, she's probably trying to please her mom. No, I'm not doing that. And she was probably scared.
Yeah. Which I can see. I mean, I got pregnant when I was 17. I didn't tell my mama until I was 5 months pregnant. And the only reason why I said anything is because my mom figured it out. She was like, you know what? You haven't asked for tampons in about 4 months. I was like,
same.
Well, it's time.
There's a reason for that, Mom.
Yeah. So I get it. I get being, you know, coming from a Hispanic household. I totally get it. It was more fear for me. And I can't say that, you know, had anything happened, if I wouldn't, I wasn't a labor nurse. I wasn't anything medical back then. So who knows what would have happened, but I can see her being afraid of her mom. And maybe, I don't even know, like, is the mom married? Wasn't there?
She's got a stepdad. Yeah. He was crying in the waiting room. He seemed more upset than anybody. Stepdad.
Poor guy.
Yeah. So yeah, that's super true. Here, this is interesting with this triage nurse. We'll finish playing him. I've clipped these, so they're not the full length. They're just the things I wanted to play, you know?
Mary gave her some pain medication. She started feeling a little better, and then she said she needed to go have bowel movement, and that's kind of when the whole thing happened.
So what did you do after that? So when she went to do the bowel movement, where were you at?
Initially, I was at the nurse's station, and then at some point I went and kind of checked on her, knocked on the door, see if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Toilet flush?
Yes, after a while I started hearing, so I probably checked on her 2 to 3 times, I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again, did she need anything? Denied anything in it. Eventually it got to a point where I said, you need to come out. And I asked the the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that
She didn't
point?
say anything. She was just looking kind of straight past me and went back to the room.
Did you look into the restroom?
I did.
What
Yeah,
did you
so
see?
went into the restroom and I saw a large amount of blood.
Where?
And it was on the floor. It appeared to, like she had tried to wipe it up in places. It was kind of on the back wall behind the commode, the toilet. And so I said, you okay? What happened? And she said, I'm on my period. What she said. And she walked out. And then I went in. Because at this point we had already received.
See, she's still lying.
The positive pregnancy lab test.
She's already had the baby. I'm on my period.
I couldn't tell you the exact time, but I know prior to that, we got a positive pregnancy test on her.
Okay, prior to the bowel movement,
This is interesting.
did you tell her that y'all got a positive?
No, the doc hadn't been in there to tell her yet.
Okay, so, okay.
Yeah.
So he knew, but watched her run down the hall with her hand between her
looked
legs.
into
Like,
the trash
I just
can
thought that was
time
okay.
to see if there had been anything tossed. But the
Yeah,
water
right?
was fresh and completely empty. I
And
didn't
just
pick
paced
up
back
the
and
can,
forth
obviously, I
side of the
wouldn't
bathroom the whole
He
time.
was right there when she ran down there with her
So
holding her
once-
behind.
What occurred?
So after that, her and the patient went back to the room. The physician and a female nurse went in to do the vaginal exam just to make sure everything was good there. I believe, I wasn't in the room, but I believe that's when the doctor said, hey, you're testing back positive. Adamantly denied it up to that point, even with me the entire time. She said she was a virgin. She's had her period every month consistently. The doc was doing that.
And you said that, and she told you that when you were
She told me that in triage,
Okay.
that she was a virgin and that she had her last pregnancy was just prior on that month and had.
You mean period?
Yeah,
You
sorry,
said pregnancy.
I'm sorry, yeah. Her period, she had them consistently every month. So then I started doing my charting, and then we called in the housekeeper to clean the restroom. We call it like a terminal clean, just when it needs to be mopped and everything. And then she felt the weight in the wastebasket, and then
All right. Is there anything you think we should know about that we haven't asked?
not necessarily not like factual things, just
Yeah,
it seemed like we were being just deceived from the beginning. But that's just my take on it. It seemed like she was very manipulative with us. And
What did she appear like when she came in? I mean, could you because I know most women you can tell unless they're a large woman.
right.
She's a petite girl. Could you tell that maybe she was pregnant or?
I could not. She was very what would be the word? Not necessarily standoffish, but anytime you asked her to lay down, she would kind of maneuver away from you almost. It seemed like, thinking back, she wouldn't want you to kind of, it was at least what it seemed like to me, she didn't want you to discover, that she was pregnant. And she wore really baggy clothing.
Or she was in labor and in pain and didn't want to be bothered.
Yeah, and she wouldn't sit still for you.
She didn't know she was in labor, though.
Sure, she's
I'm
very
convinced of that.
uncomfortable,
I think she
yeah,
thought she was in pain, but she didn't get it. Yeah, he's a nurse.
Yeah.
All right.
The nurse not tell her the pregnancy
Can we
test
look
was positive.
So the patient.
It depends on which
Um,
kind it was, right? If it's a positive negative, but if it's an HCG with number results, we're not allowed to interpret it and say you're pregnant.
Yeah.
Right.
I went to her room. I went to get her undressed.
This is the
doctor
other
came
girl.
in.
So, yeah, I mean, it's kind of sensitive issue when you talk about results because nurses are not supposed to give the results to the patient, right?
We can't diagnose. So unless it's positive, negative,
Right.
can't really say.
Yeah.
So they sent she did the urine when they got there. That's another thing as a nurse I would have been a little bit suspicious of because she did leave urine when she got there. And now all of a sudden, so many minutes later, she's dying to go to the bathroom again. I mean, I know maybe it's a bowel movement, but still weird, right? Like, I don't know. I just think like a labor nurse. So in my mind, I would have been like,
Yeah.
I don't know. I would have.
For too many bathroom babies to trust
I mean,
anybody.
Yeah, there's fault all the way around, and not in a bad way, like against the nurses there. Like, I just think that they're in such a rural area that this just doesn't happen a ton, so they don't know what to look for. Because in every other ED, like Kayla said before, a pregnant girl stubs her toe and they're like, get her up to labor and delivery, and we're like, why does she have to come here for her toe? Like, you know what I mean? So like, I just think it was so rural that they haven't run into anything. And him being a guy, so I think somebody commented like how nonchalant they are. That bothers me. But I just don't think they're used to seeing stuff like this. So that wasn't his thought process at all, which maybe now he'll learn his lesson and hopefully.
Why did they let her mom back with her like so soon without like admitting her getting through all the questions? Why was her mom with her the whole time?
Yeah, I feel like they usually leave the mom in the waiting room until they've gotten enough information, and then because you do have to. I mean, I know even in the ER, I don't know the exact questions they ask, but I know that there's personal questions that they don't ask in front of the parents. So why they brought her back right away is beyond me too. Yeah, unless she was just super pushy and was like, "Oh no, I'm going,"
which she might have been.
Yeah.
Yeah, I mean, and then another way, another nonchalant. Yeah, that is kind of weird at the same time. But I also think they were like, what the F just happened?
Yeah.
Like, we're used to like nausea, vomiting, a little chest pain here and there, and a broken arm. What?
Yeah.
I mean, if they don't have OB, the people in the area know not to go to that hospital, right? Don't go to the hospital, doesn't have OB.
Yeah.
So they probably don't see OB.
Yeah. And my guess is they don't see it very often, and they were like it. Like I said, I don't know if it's just because he's a male, but it never. Coming from a labor and delivery nurse, but even if I wasn't an L&D nurse, I feel like that girl was in the bathroom. In my opinion, she was in the bathroom way too long. She is hiding something.
I agree. And I said that when we had our live stream Saturday. I go, when I was watching that time tick by, I go, I would have been in that bathroom by now. Yeah. I would have. I mean, no matter what, I would have opened it.
Not being an L&D, when I worked on the floor, even my patients were in the bathroom too long. It's usually because they were doing drugs or hiding something or trying to do something. Going to be an incident report. Like, you just can't leave people in the bathroom for half an hour.
Yep. And that, to me, especially in the ED, that's what's weird to me, is because anytime any patient is in the bathroom that long, you're like, what are you doing? And whether it be, like you said, doing drugs, smoking. I've had patients hide in the bathroom to smoke a cigarette, like, because we won't, like an antepartum patient that we're trying to keep pregnant because we won't let them outside. I think, I don't know, that has to change, because he definitely needs to check on people, because whether you're hiding some drugs or a baby, like, it needs to be found. Like, you don't want to give them the time, especially if they have IV access for somebody who uses drugs. You don't want to give them the time to shoot up in the bathroom through their IV.
True. And at first I thought she didn't have IV, but he says that he started an IV on her. So I think they hep locked it. And then, but later you can see that there's a bag. So they did have an IV in her. But someone else was saying that her lawyer said they were still giving her the morphine. I don't think they gave her a morphine drip. I think they did sub-Q, IM, something. I don't think she had any kind of a morphine drip going on. Yeah. I mean, they could have pushed it maybe, but whatever, IV push, but right? Like, they didn't, it wasn't like a drip. So you can't get it back at that point, because he was like, they didn't even stop it. Her lawyer said something like that. I don't think they can't necessarily stop it at that point. So this girl is the one that was with her after they found out that the baby was dead, and they gave her, she took over. She's the RN that took over then.
I explained to her that she had a miscarriage. Her mom had a back and forth about it.
The doctor says she had a miscarriage?
Yeah.
See, that's weird to me too. All the doctor saw was blood, positive pregnancy tests, and says she had a miscarriage.
Yeah.
I mean, I see those pictures of her in her cheer uniform. I don't know how her mom lived with her and didn't see the basketball she was hiding under her shirt.
I don't understand that either, because it was...
Or her boyfriend, how she hugging her boyfriend, and he doesn't notice this big basketball lump under her shirt.
Yep. And do you think they never had sex again the whole time she was pregnant? I'm
I
pretty sure
don't
that
believe any
belly
of
was
that.
in the way.
Yeah.
If you've ever had sex when you're very pregnant.
Her belly button was probably poking out like the timer on the turkey, like somebody that's 9 months pregnant.
Yeah.
For sure.
She could have been passed out on the floor, but I think she kept answering them, telling them she was okay. I think that was one thing, because Lori said she could have been passed out on the floor. But true, I'm pretty sure I would have gone in there. I would have had somebody go with me, and I would have opened that door. Probably
And then,
5
like,
or
why
6
did they have
minutes in.
to go find a key? Like, every hospital that I've worked in, I could take my badge and it's just a straight thing. You can unlock it and open the door. I don't know if they're different, but everyone I've seen, you can literally take the side of your badge and turn that lock and
Airplanes
get into the
too.
back.
A flight
Yep.
attendant can just
Into
go
the
this on an
bathroom.
airplane and open it. So, you know,
They're not hard locks to pick.
No, yeah, no. So, okay, so she says the doctor told her, I guess you had a miscarriage. So, Alexee, what's going through her mind? Now her mom knows it was a positive pregnancy test. She's still arguing with her mom, saying, no, I've never had sex.
She said it seems essentially like, I'm not sure the exact word. So she felt that. She said, it seems that you've suffered from a miscarriage, which did seem totally abnormal. It seemed awful miscarriages before they're very bloody. And so
Was she bloody?
Mhm.
Like
And then
her legs?
yeah, she had blood all down her legs, and then there was like blood in the bathroom everywhere. So
Okay. And you saw that? Okay.
and then got her in the bed, got her in a gown, helped her clean up. Doc came in, we did the pelvic, essentially, and then HT had come in and took the doctor away, and then I helped her get back in the bed, get her comfortable, and go get her blankets. That's where the baby itself was in that room where the blankets are. So then I went back in there and just took care of her tried to as a postpartum patient from then on.
See, she's like, tried to take care of her as a postpartum patient? Like, I don't know. Fundus? What?
Did she
Yeah.
say anything?
Like, I don't know what to
Did
do.
you say anything to her?
Once we all figured out what was going on and I went in there, she essentially was scared. She was worried that she was going to get in trouble. She did have a back and forth with her mother that was just about like, they had said, the mom was upset because she had had sex and hadn't told her. So they were going back and forth on that, and then she was just denying it, which was a little wasn't really deniable at that point in time.
Right.
So the patient was denying having sex at this point to her mom.
Yeah, she was trying to state that she was still a virgin.
After she came in from the bathroom and all the blood and all that.
I mean, at that point, it's kind of like,
Did the pelvic, and then I think shortly after that, the mom was in the waiting room after that. And then she was just worried. She was asking.
Is it murder, though? I don't think so.
Did not know.
Is this when you found out she was worried about getting in trouble? Did she tell you anything like?
but okay, here's my take on that. I think that it's no different than a hit and run, though. You know, you give a 16-year-old a new car and you go, and then they hit somebody and they run and they go home and they're scared and they don't tell anybody.
He's not getting charged with first-degree murder, though. He's probably not getting charged with the first degree of anything. I mean,
right,
true. She's guilty of something, but not. I don't think
this wasn't premeditated murder. Right? Yeah. You don't have, but actually, premeditated. You can premeditate it within seconds before you do it. So that's where first-degree murder gets a little dicey, because there's not like okay, I had to plan this for a month or a week or a year. You could literally plan it for 2 minutes, and then you could still be considered first-degree murder.
Yeah.
What does Francie say here? Francie said, if she had not delivered the placenta, wouldn't the cord have been visible? She
could have tucked it back in there.
If she
ripped it off the placenta.
Like if the placenta was still inside of her and she ripped the cord and the placenta was still there and it didn't deliver, then yeah. But the placenta came out. And I don't know what she did with it, but she did something with it. She had to flush it down the toilet. They said they heard the flush going a bunch of times.
She had to have, because, I mean, I know it's big and it probably didn't.
It's like ripping apart a ginormous, thick, raw steak with your bare hands.
Liver. I picture it like, I was like, it's like, placentas are like
Yeah.
this big. They're probably 3 pounds, right? 2 pounds, 3 pounds, 2 or 3 pounds.
And it
Depending.
does liver, you're right.
Yes, the placenta did come out because nobody found it. The ER doc was concerned that she didn't deliver the placenta and wanted to send her, get out of here. This is what the ER does, though.
And they had no
Nothing against the
ultrasound
ER.
to see.
They're like, you're an OB patient, you got to go. Go upstairs, go here, go to the other hospital, get the helicopter. No, we don't do OB. Like, it's just like she was saying, like, oh, you got a broken toenail. Okay, well, wait, you're pregnant. Go to OB. Like, whatever you got, whatever your problem is, it's OB can handle it. You know, we don't do pregnant people.
Yeah.
It's really kind of funny because we'll be like, why are you bringing her up? She broke her leg. Like, well, you have to clear her first. You have to clear her first. I'm like, okay, yeah, we have to clear her first. We have to clear her first. But get her out of here. So, they did do an ultrasound on her after she delivered. Yeah, they did. They called the ultrasound tech in. This is a rural hospital. They weren't there.
So I
She
drove her
wasn't there.
tractor and it took her a while.
What? She drove her tractor in?
They say rural hospital, but it's New Mexico, right? So I don't know. I just don't see rural as desert, but I guess so.
Yeah, you could be rural desert. Go look behind my house. I'm happy you're talking about this from sort of an insider perspective. I think the hospital could have done more, but she's 100% responsible for his death. Yeah, I think there was a little bit of like, they're going to really try to throw the hospital under hey, Lindsay, how are you? Under the bus quite a bit with this whole thing. And there are some things, I don't think they broke any protocol though, the hospital. Do you think they...
I don't
I
think
think they're going to have a whole bunch of virtual learning in their little learning
Oh,
center
yeah.
after this.
they're going to have some learning to do, whether they have it in a meeting or on their annual stuff. But I don't think there's necessarily a protocol, but I don't think that guy, I'm trying to like rack my brain. I'm like, what made him leave her in that bathroom so long? That drives me crazy.
And he's a triage nurse. So
Yeah.
triage, you have to be a pretty good nurse. They don't let anybody just triage. Like in OB, you can't triage till you've been there for at least a couple years.
And
So
that drives me crazy. So there's definitely going to be some new protocol stuff in that hospital for sure. Because, I mean, even like we said, had it been a drug addict with an IV access who potentially could have overdosed in that bathroom and you left her in that bathroom that long, come on.
Then that's your fault.
Yeah. I mean, it's definitely.
They're going to have like the huge RCA meeting about it.
Yeah. So, and I think at the end of the day, and obviously this is a rural hospital, so who knows if this is even a thing, but, and I told you ladies before, we had a similar situation at a facility here in Phoenix where it was a 14-year-old girl who did this because she was abused by her stepfather, and she had the same situation, went into labor, was taken to the ER by her mom, delivered the baby, threw it in the trash, came out, housekeeper found the baby. She wasn't charged because they charged the stepdad with sexual molestation and all kinds of stuff. But it makes my biggest thing is I feel like safe havens are not advertised enough. People don't know they're a thing. And I also feel that maybe now with this generation, you know, you can tell it a million times. The truth is always better than a lie. But are they really going to believe you? And then, so I feel like even the ones who do know about safe havens, they're probably like, how true is it that I'm not going to get in trouble?
right.
How true is it that I'm going to leave this baby in a box and nobody's going to come looking for me? Lori, no, that baby did not live. That baby died as well.
I do think they probably should have investigated the bathroom more when they saw all that blood.
Yeah.
They should have done more than call housekeeping. That wasn't amount that anybody could equate to a period.
Right. She said, oh, I'm on my period. Nobody throws their period all over the bathroom walls and stuff, you know.
Yeah.
I mean, Last time I
And
checked,
especially after hearing all that noise, and she was in there for
all
so
the
long.
flushing going on. And
Teenager coming in for abdominal pain, and you already know she's pregnant because you can see the results, sir. I think they probably should have investigated the trash can
faster.
before housekeeping had to find it.
Yeah, I
A
don't.
poor
think-
housekeeper. I feel bad for the housekeeper.
I feel so bad for her. But
That
she
poor
was telling an interview that a couple years before her boyfriend blew his brains out right in front of her. This poor lady's gonna have so much PTSD.
No.
Yeah, they have an interview with her. I mean, yeah, it's crazy. Go ahead.
How many minutes, Kathy, until after they found the baby? Was it?
She came out of the room at 1:58. She came out at 1:57. Housekeeping was in there cleaning at 2:08, still cleaning at 2:18. At 2:25, she brought the trash out.
Yeah, no.
So way dead by
Yeah.
then, suffocated for sure. 2:08 to 2:25. Yeah, there's no way. But they could have given it Narcan if they would have known.
Yeah.
At 2
Alice.
o'clock, and she went in there at like 1:40, 20 minutes. She didn't deliver like right away. I mean, there's still a chance for the baby if they would have looked, maybe. If she didn't do anything else to it, like hold the trash bag over its head.
Oh gosh.
Yeah. Let's see, Lindsay. I was researching this case and I actually came across a photo of the bathroom. I can't tell if it was after housekeeping or before, but it wasn't nearly as bad as was described in the interviews. Interesting.
Birth is messy.
Birth is a bloody mess, people.
Especially if her water hadn't broke yet, and it broke while she was in there. It was messy.
Yeah, she made a mess in that bathroom for sure.
Yeah. I mean, if you have just a normal controlled birth with somebody with an epidural up in stirrups, the blood's, it's gross. Like
we put a ginormous Ziploc bag under their butt to catch it all.
Yeah, a big like this with a big bucket in it, and then the doctor usually has blood. The midwife or the doctor, they have their gown on. It's bloody.
Yeah.
I mean, I've gotten blood in my eyeball in a delivery before. I've gotten blood in my hair. I've had blood up my
shoes
arm.
and socks.
Yeah.
Yep. I've had all kinds of fluids everywhere. And
Thank you. Yeah.
I do like a little game now with my husband. Whenever I'm working, if I get something on me, I send him a picture and I'm like, guess the fluid. And he's like, that's gross.
Name that fluid.
Yeah.
Okay, let's see. This girl, okay, I want to go to the next
She
thing.
didn't say anything about what had happened. She was just essentially worried that she was just going to get in trouble.
So she kept saying she thought she was going to get in trouble. This nurse that was taking care of her right after.
Did she ever ask about the baby?
And so her getting in trouble. And anything other than that she talked to you about?
She did at one point in time when the ultrasound tech was in the room with her. Asked,
Chrissy, lay down.
if there was anything, she pretty much said, would there be any like bad outcomes if she had started stopped taking one medication and stopped taking another? And I said, well, what medications are you talking about? She said, well, what would happen if I stopped taking birth control, started taking weight loss medications? And I was like, I don't know.
Did she think pregnancy was just getting fat, nothing else involved to it?
Yeah.
Yeah, I'll prevent myself from getting fat and keeping a baby by taking skinny pills.
Yeah, Percy, stop.
What pills she was taking? Like, did she just go to Walgreens and get some
Phentermine.
Oh.
Yeah. She had phentermine and caffeine in her, and the baby had phentermine and caffeine and morphine.
Wow.
So I don't know if she thought like, well, my belly will grow when I'm pregnant, but if I lose weight while I'm pregnant, it won't grow as much. But she looked pretty darn pregnant in those cheerleading pictures. Like I can't imagine any of her friends just thought she was just fat in the middle. Like, no.
Yeah.
I don't know. I mean, unless they're a very naive group of people over there, but I think they're can't be. People watch TikTok and stuff.
I mean, did her mom spend enough time with her to notice? Like, she had to have noticed that.
You would think, well, I think that's what the next one is. The next one.
Does she not hug her child? I mean, she's still in high school. I don't know.
Right. And that belly is not mushy. You know what I mean? Like a pregnant belly is taunt. Here's where they confront her.
I'm sorry. We discovered a dead baby in the bathroom. Oh my gosh. I'm sorry. I didn't know what to do. Lexi, I told you about this. I just asked you, baby, to tell me the truth.
Her mom doesn't really seem that shocked.
She doesn't.
Right.
And that comment gets me every time I see this. We talked about this. Why would you talk to your 19-year-old about dumping babies in the trash can?
Right?
That comment gets me every time.
Yeah. I told you about this. We talked about this. I wanted you to tell me the truth. So her mom obviously suspected very much that she was pregnant.
Yep.
It's just weird. It's a really weird, dynamic. Let's see. Okay, here's the bloody picture. Let's see. Yeah, there's not that much in this. I wonder when, even worse, there's blood dripping down Lexi's legs. Who took this picture? This is weird. It's like, let's see if I can, I don't know if you can see it. It's like,
I don't see a scene of birth.
no, this is, you can see pink, like it was wiped up.
Mm-hmm.
And there's splatters, but they said, and there's some more splatters over here, but they had said like this wall right here between the toilet and the thing was full splattered.
Yeah.
And I don't see the trash. Oh no, there's the trash can. So the trash can's still in there at that point in the corner.
Yeah.
See, Kayla, like it's not a big trash can. It's just one of those small ones. Because Kayla was like, if it was one of those kind that were in the patient room, like in the L&D rooms, those big ones, and they threw stuff in it and then they took it all out, she might have been able to get away with that. But this little trash can, not so sure. Okay, so we'll finish this part right here.
What did you do to it? Okay, stop right here. Stop. Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly. Yeah. I've spoken to the obstetrician at Loveless. They want her up there as soon as possible. I need your permission to transfer her for medicals. She's
19.
Oh, you're right.
She's 19.
She's a student too.
Yeah.
Still 19 years
You're right. You're right.
And the mom's like, but she's a student. Nope, don't count.
Yeah.
See, her mom didn't let her do anything on her own.
To left Loveless to labor delivery. Will you please agree to that? Yes. Okay, very good. I'm gonna work on that. In terms, I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, you do have to have the police involved. And nothing was crying.
Nothing was crying. Nothing.
I know, but the baby.
Also, that rumor or whatever, somebody's saying that she named the baby. I don't believe that because she did not attach herself to this baby at all.
She did not. Nope.
Nothing was crying. Nothing.
Mm-hmm.
I don't believe that because if she would have told her friend that she named the baby, she would have wanted it.
Yeah.
I don't know, right?
You
just
you only name something that you're obviously like happy about or like excited about. Like she has like no emotional attachment to that baby.
nothing. Nothing was crying.
Baby's gonna have to dip in for autopsy and there'll be an investigator and everything. I'm really sorry, guys. I'm sorry. I'm so sorry, but we need to do this correctly. And I want to be transparent with you about what our steps are gonna be. Officer, do you guys need to talk to her before we get her transferred?
How long is it gonna be before you have to transfer
I
out?
don't know, are we working on?
Okay.
Are you think 20-30 minutes? Yeah, hopefully, yes.
I got detectives on the way, so they're gonna be talking.
Okay.
She looks like she had 12-year-old in this picture, in this scene, you know?
It's full term.
Even the mom called the baby in it. Mhm.
9 months?
Nothing again. Nothing was
Let's see.
crying.
Have you watched the news of the girls that what they do to their babies? And
They
what
got their
go to
acting
jail?
skills from TikTok.
It's crazy.
Chat GPT wrote the scene.
Yeah. Yeah, Mom did.
Any other questions?
So that I thought,
So as of right now, like I said, is we're gonna have the detectives come over here and they're gonna talk to you. Okay? We have to gather some more information about what's going on.
the detectives didn't wind up talking to her that night because they wanted to make sure she was medically stable. So they took care of all that first. Took her, sent her to Loveless.
Okay, so I'm not gonna tell you. I can't tell you nothing on it. Okay? All I can
But
say
she's
is
not gonna go to jail.
right now
Doesn't
she's
know.
no. Right now she's being detained, so she's not.
She's not going to jail yet.
Okay, so one of us will
Is
be
it
in.
your custody? Like,
Yeah, she's detained. Yeah, she's not under arrest, but she is detained. Okay, she's not free to leave. So while this whole thing is coming up, is you're not free to leave. Okay, one of us will be in here the whole time with you, because you're not going to try to leave or nothing like that. All right. Like I said, the detectives will be here. They're going to talk to you. I mean, your care is of the utmost right now. Okay, they're going to do what they need to do to take care of you.
The family filed a wrongful death.
Or whatever. Like I said, the detectives are already been notified. They're already on the way, so they're gonna come talk to you.
I mean,
And you be grandmother?
I want.
The family filed a wrongful death suit. I mean,
the hospital could have prevented it, but they didn't cause it.
Right.
Yeah.
And there's so many lies left, right, and center. I mean, just the fact what's going to get her, I think, is she was still lying that she never had sex. So if she's lying to her mom that she never had sex after she already dumped the baby, what's to say she wasn't lying from the minute she walked in and knew she was pregnant? You know what I mean? Like, I think that'll get her because clearly she's lying at that point. So who's to say she's in a big fat liar all the way along?
Yeah.
Like, I didn't know I was pregnant. I was pregnant. I've never had sex. That's a lie. That's an absolute lie. 100%. We know that. You know, you can say you never knew you were pregnant, but never had sex. That ain't going to work right now. You're not the Virgin Mary, lady, girl. Now, this is when they come out and talk to the boyfriend. That's the boyfriend's mom, the boyfriend, mama, and stepdad.
So you'd
I'm
be the
her mom.
you'd be the Destin's grandmother.
Yes.
Okay. Just wanted to make sure.
So she. That's her boyfriend.
Mr. Boyfriend, do you have a driver's license?
Mr. Boyfriend.
Mr. Boyfriend.
And is the address on you current on the driver's license? Because determining what all my does, if she's still in medical, then they do release the infant back. It'll have to be released somebody. It'll be up to all my who they determine next of kin is. Maybe the parents.
They named him Alex.
Maybe you. Okay, so that's
Oh.
All right, Lindsay. That was the name that the friends said they were going to name him. So Lindsay just sent me this. Well, Lori sent it through Lindsay. But New Mexico court's case lookup. It says the decedent is Fierro Alex Ray, and then the attorney is Richard Damon, and then the interested party are Alexee Trevizo and Devin Ray Fierro, and Arthur Bustos is the petitioner. Who's Arthur? So yeah, the boyfriend and Alexee and Arthur Bustos are suing the hospital for the murder or the wrongful death of Alex Ray Fierro.
That baffles. You know what though? It doesn't shock me. It doesn't shock me because I mean, look at that lady that spilled McDonald's coffee on her lap and won, even though she knew it was hot coffee.
Yeah.
Ugh.
Informal. Okay, June 30th. Petition, informal petition for appointment of wrongful death, personal representative for wrongful death action. Wow. There's a judge assigned, so we'll have to follow that, see what happens. Huh. So this one is when mom shows her real colors though here. Have you guys all seen this?
I've seen this one, yes, and that mom is a piece of work.
I didn't see this one.
All right, well, here we go.
Alexee.
Oh, wow.
Yeah, I think they went out.
It gets better, the wind.
I will give it to her whenever. She can see the word.
This is my house. I
Right.
have a right to see the warrant.
I'm letting you know she has a warrant for her. We have a search warrant for your house. We have a warrant for her.
Okay, can you see the warrant?
She gets a copy of it.
Can I go up there? Will you take her up there?
You can go to the detention. Do you know where it is?
Everything?
It's
Okay,
lower.
so what is she under arrest for?
She's over 18. She's got
I understand that,
Right.
Detective Gonzalez.
Right.
What is she under arrest for?
She has a warrant for arrest.
For what?
That's all. Okay.
What do you mean that's all you're gonna tell me?
She's over there.
I understand that, but I have a right to know as well.
We'll tell you that.
Okay, then let me know now. Let me know now. I'm giving you the corporation. I told you answer my question. What is she under arrest for? What is she under arrest for? No, I'm not bringing her out here yet. Let me know what she's under arrest for. For what? For what? For what?
You okay with telling her?
Tell me.
Homicide. Open count of homicide. And tampering with evidence.
Tampering with evidence?
Yeah.
At the hospital?
Cole, can you hear me?
Give me a minute.
Okay.
I'm assuming she's calling her lawyer here.
That's my guess. I just don't know how you can be so like blatantly like I feel like that to me right there is like guilty behavior. She's trying, and I get that she's trying to help her daughter, and I get she wants to know everything, but it's like just cooperate. Just bring her out. You already know what happened. You were there. I don't.
That's so true, though. She does.
I agree, Jennifer.
Wrongful.
I think this poor girl needs a psyche
Tampering
though.
with evidence. Tampering with evidence. Leighton says she sounds like she would ask for a manager at McDonald's. Yep. She mad.
I have a right to see a warrant. It doesn't matter if she's over the age of 18. This is my house. You have a right. You have to show me that warrant.
If we are searching her house,
Even if she's under arrest, you have to show me the
it's
warrant.
up to her to show us.
Do they have to show her a warrant to go inside of her house if they have a warrant to go in the house?
Yeah, but they said they don't have a warrant to go in the house. It's not for her house. It's just for her arrest. So they're telling her, we don't need to give you a warrant. And she's like, yes, you do. It's my house.
No, she should have just been like, she's not here in court.
Exactly, right? That I would have been like, well, she's not here right now, so.
I think that's why this other cop went around the side. Do you see? He went like out around the back. At one point, he goes over here and stands over here so you can see the back. Because the boyfriend's mom shows up during this too.
Yeah, she's here. She's here right now.
Her lawyer was like, go get her. Don't fight them.
Yeah, I think exactly, because then she winds up saying she has to go.
That is the policy.
I will give it to you. Please don't. Please don't.
We understand, but we have to do our jobs too.
I understand that. I understand that. That's Melanie. That's Devin's mom. She's good. She's okay.
We're not gonna be rough with her or anything. We're just gonna take her over there and book.
Please don't be rough with her, please.
Just bring her out. You can be with her the entire time. Okay?
You know where the public safety complex is? 3300 West Main?
You can follow us over there. I will take you there. You can follow me over.
I mean, she really wanted to hide her. She shouldn't have took her home when they left the hospital.
Right? Could have got on a bus somewhere. And this is May.
Alexee, do you know your date of birth?
She's. This is May.
Oh, they had 4 months to go somewhere?
Yeah, and the mom says she's still bleeding.
Yeah, I'll go get it.
She's not still bleeding in May.
Yeah.
Hopefully she's bleeding back on her period, not pregnant again.
Are you okay with your mother getting the criminal complaint? It has your personal identifying information on it. Serial number, date of birth.
Yes.
Are you okay?
Yes.
Okay.
Yeah, Francie's right. They were so nice. I don't know why.
Serve you first, then your mom can get it, okay?
Don't be. Are they being rough now? You're causing an issue.
I do. He's gonna move his unit around. No medications, anything you need to take while you're in there?
Yes, I know.
Okay.
She has still been like bleeding, so I don't know if she needs.
Do you have any? They do. I don't
Should
know
have got her
if
help
they
for
have
that a
lots.
long time ago, ma'am.
Okay.
Yeah.
That's supposed to be gone by 6 weeks.
Longer than 6 weeks from January 27th.
Take your little bag. Go ahead. Go ahead. Go ahead.
Go ahead. You can go in. Make sure she's not getting a gun.
Just make sure you're doing. Okay. And it's nothing sharp, no flammables, nothing sharp. Okay. Okay. They're gonna check.
It happened in January. She was arrested in May.
The address is 611 North First Street. 611 North First.
Okay, we'll check those. Thank you. Okay, we'll check all that when you go.
Now she gets the tampons.
Yeah, go ahead and grab your stuff that you need, because they're not even gonna let her keep that in the jail anyway. So what? Why did you let her grab it?
All right. What's in there? Personal pads. Personal pads.
Yeah, she needs them.
See her mom? She needs them. She needs them. Her mom is really.
Yeah, her mom.
West Main Street Public Safety Complex. If you just go through the front door, you know where we first spoke in the records.
All the time we see them together. The mother has not
I
touched
hope
her
that
daughter
she
one
gets a
time.
psych eval so that she gets the appropriate sentence.
Okay. I'll get with him and do all stuff. Go to dispatch.
Her mom is nuts.
Her mom is.
Yeah.
Part of this problem.
Her mom is a huge part of this problem. The lawyer seems pretty on the ball about things. I was like, he annoyed me because this morning I thought that he was I was listening to one of the interviews with the lawyer, and he was saying that they never told her she was pregnant before, but I had my stuff out of order, and they did not tell her or her mom that she was pregnant before she went to the bathroom, which I think would have been a big deal. That doctor should have went in and said, we got a positive pregnancy test, Mom, step out. Alexee, the test is positive, you know what I mean? At that point, with the pain,
I think Mom Karen is just worried how her friends are going to see her, not anything really about her daughter.
Right.
She's now Mom Karen.
She's Mom Karen. I want the manager. Give me the manager of the sheriff's department, please.
Yeah.
So that's okay. They take her away now. I don't think is there anything else I videoed? I don't think so. So between the doctor, there's an interview with the doctor too. But what I see in this whole thing, some of the clusters that should have been prevented is she went in the bathroom by herself too long. They probably should have told her that she had a positive pregnancy test to prove that she was lying earlier before she could go in the bathroom and say she had. Any pregnant person that tells you they have to have a bowel movement when they're in abdominal pain of any kind, you're like, oh, no.
Yep. Yeah, and which is why I feel like they need more education in that ER, because still the length of time that she was in the bathroom. And if you knew that positive pregnancy, even if the doctor hadn't gone in there, then maybe the doctor should have been the one knocking on the door trying to get her out. Like, because she knew. So, I mean, obviously you're not going to go tell mom because she's 19. So you're going to go tell mom that her test was positive. But, you know, Lexi, we need you out of this bathroom like yesterday. Get out. Somebody should have been there. I don't, there's just.
I agree.
There should have been on there and been like, I need you to come out of this bathroom now.
Like, I had a real unexpected bathroom delivery and I had to sit in my nurse manager's office and explain it.
Yep.
I feel like ER, your rural ER, you have to have people that handle everything. Somebody can walk in with their arm cut off because it was the closest hospital. You have to be able to keep them stable until you can get them sent out. Do they have like a whole bunch of travelers? Are those permanent staff?
Yeah.
I think they're permanent staff because as they interview each one, and I'm not going to play all that, but as each one has an interview, like it's all on there. They interview the RN in the triage. They interview the housekeeper. They interview the CNA. They interviewed like everybody that was there that night. And they ask them all these questions, and they all are from or live in the area. The charge nurse kind of sounds like he might have been a traveler because he's been a lot of places, but I don't know if he'd be a charge nurse as a traveler, would he?
Maybe. I have been.
I've seen some travelers be put as charge when they're desperate enough. Yeah.
It's desperate hospitals.
Okay, because he said his nursing license is in Oregon, but he's compact. So, on his interview, Alice, I think I would have given her Narcan as soon as the test results came in.
We give morphine to pregnant people all the time.
Mm-hmm. Yeah, we give morphine to people all the time.
Even in labor.
Mm-hmm.
Fentanyl. Hopefully they don't deliver with it. Yeah. Hopefully they don't deliver soon. If they do, there's NICU. Some mom thinks IV pain medications are better for the baby than an epidural when it's really not.
Definitely.
Right. But yeah, that's one thing that I want, because a lot of the chats that I've seen in other channels and stuff talking about this case, I was like, oh my God, that hospital gave her morphine. They gave her morphine. You never give pregnant women in morphine. No, that's like the worst thing ever. Don't give pregnant women morphine. Well, first of all, she's lying about being pregnant, but maybe she didn't know she was pregnant, but they got the test back. But either way, it's still protocol in a lot of places in labor and delivery to go ahead and give morphine on pregnant person.
I mean, like they do what, like the labor rest or whatever, when maybe they're in early labor, maybe they're not. 4 milligrams of morphine, go home. If the pain comes back, maybe you're in labor.
Yeah, they do that too. They send somebody home that isn't in full-blown labor, give her some morphine, tell her to go home, go to sleep, and come back when she gets further in labor. Yep. So yeah, that's not unusual. So there's no reason to give her Narcan, I don't believe.
Unless they were sure she was about to deliver, but clearly they were not.
They let her go in the bathroom for 20 minutes by herself.
That is my biggest problem and my biggest pet peeve.
That is my biggest problem.
Even if I weren't delivering babies, my patient's not going to be in the bathroom for 20 minutes because you're probably shooting something up, or you're getting something ready to hurt me or hurt yourself, or you're having a baby.
Yes. That's that right there. There can be so many things going on in that bathroom, but none of it is good. You're not doing your makeup that whole time.
I mean, even if you're having terrible diarrhea, like somebody can come in and make sure you're not dehydrating and dying in there. You know what I mean?
Yeah.
Like,
like somebody commented earlier, what if she was passed out? Like, open the door and check on you don't leave a patient in the bathroom that long without saying, hey, I need you to come out now or I'm opening this door.
I mean, the triage nurse talked to her and assessed her. So if she's not acting like a mature 19-year-old, she's an immature 19-year-old, like that should go through his head. So he should be checking on her.
Yeah.
Right.
Yep. Yeah, I think that was a huge fault in this whole thing, is just how long they let her hang out in that bathroom.
Because if they would have gotten in there sooner and caught her either trying to wrap up the baby or within minutes of the baby being born, they maybe would have been able to resuscitate that baby. Because they're pretty.
Or had they investigated the bloody bathroom when she walked out?
Right. They housekeeping.
She made a mess.
Need a terminal clean in here. We're not touching it. Come on in. Yeah, that's kind of huge too, right there. Not just a miscarriage, but from what they described, that bathroom was pretty crazy. So they didn't really inspect it. They called housekeeping to do all that.
It's not easy to hide that you gave birth somewhere when all you have is paper towels and water to clean up.
Yeah. Yeah, for sure.
And all the paper towels in that trash can would have been red and soaked. Or she flushed them all.
Yeah,
well, that could have been too.
That's probably what she was doing
with her placenta.
Flushing her placenta. Surprised she didn't flush the baby.
They're gonna have issues with that toilet for a very long time. To come until
every hospital I've been to has got the signs by the toilet. Only flush toilet paper and nothing else, because we're a hospital, we're cheaply made, and our plumbing isn't designed for that.
And you know how many times on our unit the toilets would back up? We had a brand new building, brand new unit. They're like, no, the toilet's broken in there. The toilet's backed up in there. Don't use that one. Don't use that one. So yeah. Francie says there's another video where mom is in the police station right after they took her in, and she is upset that it was leaked and the people at the school were talking. She also said,
I saw that.
And they broke HIPAA.
Violation.
Mm-hmm. She was all pissed off
it's
about
a small
HIPAA
town, ma'am. What do you want?
Yeah. I really don't think the hospital is going to get in trouble. Like you said, there's going to be a lot of learning for them.
Yeah.
They may want to get some staff that actually like hire some ER nurses that are OB nurses, because that's what they did here. I worked in Newport Beach at Hoag Newport, and we had labor and delivery, but they opened Hoag Irvine, and Hoag Irvine was not going to have OB. So they took a couple of our OB nurses, made them ER nurses so that they would have OB nurses on staff in that ER over there, because there's no OB. So something like that they probably need.
Yeah,
because there is a difference.
Yeah, there is.
If there was an OB nurse in there, they would have been like, she has to poop. She's calling back pain.
Yeah. Don't let her go to the bathroom.
Right away. It would be like, in my mind, it would have been the first thing.
Yep. Yeah.
I mean, with it being an ER too, based off how they're treating her, like, what if she was like an assault victim and she was coming in there, you're leaving her in the bathroom, she's with her mom. I mean, none of it really makes sense. I don't think her situation at all was handled appropriately. I hope she gets a psych eval and she serves an appropriate sentence in an appropriate place.
Yeah. I think there'll be a plea. I really do. I don't think she's going to go to trial. Do you? I don't know.
I would hope not. But with her
I don't think she's going to take a plea. She's suing the hospital for wrongful death.
Yeah. Yeah. That's what I was going to say. If she's already doing that, her mom has.
Yeah, it's true.
A piece of. So I don't think she would let her do that.
She's going to let her go to trial for murder, though? Whew. Maybe that's part of their negotiating. We'll drop this if you lower that.
Yeah, and I mean, maybe, hopefully somebody talks some sense into that mom. Like, somebody who maybe knows, maybe even the lawyer. Like, hey, she can go to jail for a really long time.
Maybe she's watching. Let's tell her what we would say to her.
Don't go to trial.
You should have been in Mexico in those 4 months before they came and got you.
Yeah, you'd be surprised how many people watch these videos that are family or related. Or I get comments all the time. The other day I got one. It was the great uncle for one of the cases we're talking about. The Noah McIntosh case in Irvine. His aunt has posted comments in my thing. So they watch these things. So if Alexee's watching this or mom's watching this, we're OB nurses, you probably should
take a plea. Fess up. I mean, she already fessed up. We already got that, but take
or go see a psychologist for your psychosis that happened with all those hormone changes.
Right. Well, and that's what Kayla was saying too. There is perinatal depression, there's postpartum depression, there's perinatal psychosis, there's postpartum psychosis, there's mental health issues that could be at.
I was involved that one night with that lady that was trying to kill her own baby that came into triage, said we looked like B words and left. And driving back to the hospital, I mean, she didn't look like she was in active labor. She looked fine. She was talking, looked a little angry, called us B words, said she didn't want us to take care of her, left. Less than an hour later, code stork, she delivered a baby in the car, and her boyfriend was trying to keep the baby away from her because she was trying to smother it on the way to the hospital. I mean, you never know what somebody's mental state is. And we don't have her medical records. Her mom would never let us see her medical records. So we don't know.
Right.
There are so many things, but I definitely think the mom's a huge problem. Obviously, the way the ED handled it is a problem. If she's watching this, throw your mom under the bus. Get rid of your mom. I know she's your mom, but get rid of her.
Mama made me do it. Mama Karen.
Right. Alexee, you're 19 years old or 20 almost now, right? 20.
Cut that cord and get, like, she's not helping the situation at all.
You cut your baby's cord. Now you need to cut your mama's cord.
I'm voting on she chewed it.
Sorry,
I just really
that
want
was
to know. So can she give us
but-
that information? I think she chewed through it because that's what my person did when she was trying to kill her baby.
She chewed through the cord?
Mm-hmm.
Ugh, gross.
That's what the demons were telling her to do.
Well, you know, Alexee could use that. The demons told me to do it. You know, I don't know, but if she's watching, hey. Well, you know, Lori, you've been here long enough. You know that they sometimes come, they watch this stuff. So if they do, that's our advice as nurses. I can't say the hospital did everything right, but I can't say they're at fault.
Yeah, they're definitely not at fault, and
they didn't cause it, but they could have prevented it.
Yeah, I think there's definitely
could have prevented it.
But I have
her mom could have prevented it.
Yeah,
a school counselor could have prevented it. Her cheer coach that had apparently asked her if she was expecting could have had a better relationship and talked to her, maybe found out. Who knows? But it's all in the past. Nothing that can be changed now.
Yeah, nothing can be changed now. She definitely fudged that one up. But I think now cooperation, obviously, and then maybe like a plea deal, because you're guilty, Chica. You did it. But there's just...
And that autopsy shows that baby took a breath. No matter if you said nothing was crying or not, that baby took a breath. I don't know if you stimulated it and put it in the bag and then it took a breath, but it took a breath.
Yeah. I wonder
everyone in the audience of the basketball game could have prevented it.
I don't know that she would have known to stimulate it, but maybe just trying to pick it up and, you know, take the one bag out and just moving it in that sense. And then.
Right. That's what I mean. Like just that movement and everything. And the baby was like, and she didn't even realize that at that point.
Yeah.
Yep. It's like JJ and Tylee. So many people could have saved this baby. Yep. If they would have listened to Charles, if they would have listened. Yeah, exactly. It always is like a chain of events that screw everything up, you know, in the end. So, yeah. Anything else you guys want to say before we stop? Thanks for coming.
Oh, thank you for having us. It was fun. I was nervous.
Yeah, were you? It's fun. It's just like us talking, you know, when we got our friends here. But I don't usually do weeknight ones, so it's not super crowded in the chat. It's perfect. It's nice. And people can watch the replay. And then we can keep following it as things go on, too.
Definitely let me know anything you hear, because I
want to know if she gets paid from that hospital.
Oh, yeah. We'll watch.
I want to know what happens there.
Doesn't it make you want to hope that if we're ever in a situation, we do the right thing? Yeah.
Absolutely.
Yeah. You know, and that stuff happens. There's times when I think back on something that happened at work and I'm like, oh my gosh, thank God I listened to my gut on that one, you know?
Yeah.
Because
it happens a lot in L&D. It happens so much. You're like, things could have been so different.
These things cause me to talk to my kids so much more. Like, they're getting older. So I'm like, if you go to a party and you get drunk, I'd rather be mad at you because you call me at 3 a.m. and I have to come get you than have a police officer knocking on my door at 3 a.m. because you're dead.
Mm-hmm.
Yeah. My son, Nick, was good about that. He would call me and pile his drunk friends in my car. And I had to work the next morning, 1 a.m. I'm like, well, all right. As your friends puking behind me and driving.
I
and
blame
I got
Mama
Michael,
Karen.
my
I'm
little
just blaming Mama Karen for the whole thing.
Yeah, I do think, I mean, like I said,
they clearly don't have a close relationship.
Yeah, I definitely hid it from my mom, but our situation was very, we weren't very close, me and my mom. She was a social worker, so I always said that she like turned her feelings off when she had to go to work and then just one day forgot to turn them back on. Like she couldn't distinguish between home and work, you know? So like, she wasn't very lovable. She wasn't very like affectionate, which, you know, proof I went 5 months without anybody knowing. I even went to prom pregnant and nobody.
Did you?
Yeah.
Oh,
so, had it not been for me, like if I just would have.
No, Alexee went to prom too.
Postpartum.
Not pregnant.
Postpartum. See, nice. I mean, who goes to prom after that? Really? Oh my god.
Smiling with her same boyfriend. They're still together, keeping the secret together.
Yeah, so that's terrible. But yeah, I really do think her mom is a huge factor. The fear that she must have instilled, that comment gets me every freaking time. I'm like, why were you talking to her about this if you didn't suspect something?
I told you to tell me the truth.
Yeah.
We talked about this.
Specifically in trash cans when normally they're found in dumpsters. Don't put it in the trash can.
Yeah. Yeah.
Right, because a dumpster you might, should have went out back. I mean,
like on the news, like the abandoned babies are typically found in dumpsters. Why did she tell her daughter not to put babies in trash cans?
That's what I said at work.
Kind of the same, but not.
Yeah. All right. Well, have a good one, and I'll see you guys at work tomorrow. Thank you so much. I want you to do this again, though. We'll keep following this case. So.
We will do it again. I'm all for it.
Cool. Thank you. Thank you.
Bye.
All right. Bye. All right, you guys. Thank you so much for being here. I appreciate you all. Thanks for supporting this one. This was new for me to have my friends as guests, and hopefully you learned something. We did, and we'll keep following this case for sure. All right, you guys, take care. I will see you Saturday. I'm company, so I'm not doing a Saturday live stream, so we can just say this replaced it, and I'll see you soon. All right, stay safe, you guys. Stay well. Bye-bye.